Hey, my name is Luke Schellenberger. I'm an ENT. I'm also board certified in sleep medicine, and I treat a whole lot of patients who have obstructive sleep apnea. Over the last 10 years, there's been a lot of changes that have taken place in how we treat obstructive sleep apnea. And so a lot of patients may ask, well, what is obstructive sleep apnea? It's basically when your airway, as you drift off to sleep, and after you get into deeper levels of sleep, shuts down, okay? So if we look here, the airway at the back of the tongue, the back of the palate, all those structures just kind of squeeze together, and we start to lose oxygen, and our brain has to wake us up, and that happens over and over and over and over and over again. The traditional treatment for sleep apnea is CPAP. CPAP's been around since the 80s. It's extremely effective, not that well tolerated. And there's a good number of patients, somewhere in the range of 40 to 50 or even 60% of patients that either cannot tolerate CPAP at all and will not use it. They say, look, this thing, it may cure all my problems, but I cannot keep it on my face at night. Or they're using it, but it's not working well for them. They find it off their face at night. They're trying to use it every night, but they cannot stay asleep with it. And so for decades, since the 80s, a lot of treatments have come around for patients who have sleep apnea and don't tolerate CPAP. In 2012, a newer treatment came out. It's an implant, and the fancy name for it is a hypoglossal nerve stimulator. Most people just call it Inspire. And so that's what this is right here. This is the one part of the implant. This is the generator. This is the part that would go in your chest, right on this right side. And it's got two other parts that most patients, or most of the time, we don't think about. It's got this little lead here. So it's got this tiny little lead, and it has this little plastic part that wraps around the hypoglossal nerve, and that's the nerve to the tongue. Okay, so if I were to do this surgery, and I do a lot of these surgeries, I'd make a little incision up underneath the chin, and I'd not just find the hypoglossal nerve, because that nerve controls the tongue. The tongue is much bigger than more than we just think about this little thing that flops around in our mouth. It's this big old brick of tissue. It's the biggest muscle that we see controlling all the airway here. And researchers have known for years that if they can move that forward, that makes a big difference. And so, but the problem is that hypoglossal nerve doesn't just move the tongue forward, moves it to the side, moves it back. And so you have to find the right part of the nerve. And so that's what makes this surgery a little bit more challenging, is that I have to go and find the nerve, but then actually separate the parts of the nerve, avoiding the part that moves it back, because that'd actually make it worse. Find the part of the nerve that makes that tongue tense and move a little bit forward. Okay, and so that's where I place that tiny little cuff. So I make an incision here, put this in place, and then I have to make a second incision right here on the chest, and I'll put this in the chest, but it also has to sense when patients breathe. So a Inspire must sense when the patient takes a breath, inspires, in order to know the timing of when we want to breathe. Because, if the tongue is just moving forward randomly, it doesn't really help that much. So that's what this part is. So this part will go in between two ribs, and it senses, it's the sense lead, it senses when we take a breath. And so that part would go attached to the generator. The other part, the other lead, would attach to the generator. So we'd have basically three parts, two in the chest, one up in the neck. So again, the whole idea behind this implant is to sense when we breathe, sense when we intake a breath, and tense this muscle so that airflow, there's more flow. It's not obstructing anymore, it's more open. Since 2012, this surgery has revolutionized the way that we think of and the way that we treat sleep apnea from a surgical standpoint. It does not replace CPAP. In fact, if somebody comes in and says, I've never used CPAP, but I don't think I will, I said, you have to use CPAP, because there's a good number of patients, again, 30, 40, maybe even 50%, who don't think they will like CPAP, nobody really thinks they'll like CPAP, tries it and says, man, this changes my life and I don't have to undergo surgery. So again, CPAP is always the first line therapy, but when patients have moderate to severe sleep apnea, Inspire, from my standpoint, like I said, has kind of revolutionized the way that we think of sleep apnea from a surgical standpoint, because it is vastly more successful than other surgeries for sleep apnea. It is much easier to undergo. Now, there are two incisions, but compare that to traditional sleep surgeries where we would remove tonsils, we would remove adenoids, we would actually try to remove the part of the back of the tongue, we would trim the back of the palate there, we might work on the nasal airway. They're really hard surgeries to undergo. Just ask anyone, any adult who's undergone a tonsillectomy. It's tough, and this is more than that. And so traditional sleep apnea surgeries, there are still a role for them, but it's a shrinking role. There's much fewer patients in my practice who undergo traditional sleep apnea surgeries where we remove and move structures around as compared to the stimulator, because I really think that Inspire has made it where patients can undergo a much more successful surgery and not have nearly the tough recovery or the risks involved with more traditional surgical options. Patients sometimes ask, well, what are the steps? So you undergo the surgery. I mean, obviously you have to meet criteria first, and there's several steps we take in that. You undergo the surgery, and we wait a month, and then we activate the implant, and it gets turned on. You'll have a little remote control, and you'll basically turn it on every night, and it waits about 30 minutes because you don't want those muscles to be moving while you're awake. It waits about 30 minutes, and you turn it off in the morning. It's really pretty straightforward. Patients sometimes ask, well, what if I wake up at night? Is my tongue gonna hurt? Am I gonna not be able to go back to sleep because my tongue's always moving around because this thing's on? No, you hit pause and you go to the bathroom or go whatever you need to do. You turn it back on, and it waits a little bit of time before starting back up again. So it's usually not much of an issue. There's some little quirks and things that we have to do to help out certain patients. Not everyone who has the implant loves it. There's probably about a 3 to 5% of patients say, this keeps me up at night too. So it's not a guarantee of success, but it is much easier to be compliant with this than to be compliant with CPAP. There's no doubt about it. There's about a 95 to 97% compliance rate with Inspire in the research and in my own experience, and that is vastly higher than CPAP. Patients sometimes ask, well, what could go wrong? Well, I mean, there are rare implant rejections. That's 1% in my experience, and about 1 to 2% in the research. There are, occasions where it doesn't work as well as it could. But again, those are pretty uncommon. Beyond that, the majority of patients heal well and don't have that long multi-week recovery. They have maybe 4 or 5 days of having some discomfort around the incisions and get back to the normal routine pretty quick. So from my standpoint, I wanted to talk a little bit about Inspire. There's a whole lot of patients that have been asking me about it. There have been patients who come in and say, I want the Inspire. And they don't even know if they've got sleep apnea or not. And I'm like, well, we've got some things to talk about first. So anyway, those are my talk about Inspire, the hypoglossal nerve stimulator. Like I said, I think it is, from a sleep standpoint and a sleep surgery standpoint, it's really revolutionized the way we think about how to treat sleep apnea. That's it.